Welcome to Women's Health, the OBGYN podcast. I'm your host, Alexa Economos, along with Dr. Woodbridge from Health Central Women's Care. So, Dr. Woodbridge, first of all, what is endometrial ablation?
It's a procedure we do for women with heavy menstrual cycles, and we use a device to burn the inner lining of the uterus a few millimeters, and it greatly reduces their menstrual bleeding.
Okay, so when we're talking about heavy menstrual bleeding, I think sometimes maybe it's all relative to us women.
Yes.
How would you define or diagnose heavy menstrual bleeding?
I do think some of that is subjective to the patient, but enough to where it's interfering with her lifestyle. And if it's something she complains of and she's failed medical therapy, then sometimes this is a great procedure for her.
And do your patients who have this heavy menstrual bleeding, is it normally older women when their bodies are changing? The majority of patients, would you classify them in a certain age group?
Well, we do see a lot of bleeding problems in the 40s, but there's some younger than that have significant problems, in the 30s.
So if I was a female who was feeling like I was just done with it, how would I know if I'm a candidate?
Well, you have to be finished with fertility, like you don't want to have future childbearing.
Okay.
Is the number one thing, because it will cause scarring inside the uterus. Otherwise, it's a great procedure because it's no incision, it's done as an outpatient, it's quick, back to work quickly. So it's one of my favorite procedures because there's such a high satisfaction rate.
Oh, that's fantastic. So, and can you remind us again, is it laparoscopic or is it?
It's done through the cervix hysteroscopically.
Okay, what is, for layman's terms, what is?
We are going through the cervix into the uterus, not from above. So it's very lower risk and also no incision.
Boy, that's fantastic.
Oh, it is.
And does typically just once do it, or are there ever times you have to come back?
No, we pretty much only do them one time. There are a certain percentage, probably under 30% will fail and have to go on and do a hysterectomy or some other procedure. It has a very high 75-80% satisfaction rate.
Boy, that's phenomenal. So anyone who's not a candidate, obviously someone who's, not finished with the childbearing years, anything else that would make someone not a candidate for this?
We do require people have sampling of the uterine lining before they have the procedure, because if you have a hyperplastic or especially any atypical cells, you're not a candidate for it.
And how will you know?
We have to do an endometrial biopsy, which is like a uterine biopsy before they have the procedure done.
Okay. So say that I'm a candidate who wants to come in and I'm thinking about this. What are all the steps that I would go through to get to that actual point?
Well, we talk about the uterine bleeding, and then we'll go over options and your desires, and then we will present this as an option. It's not as aggressive as a hysterectomy, so it's a great choice for many women. And we usually then obtain a sonogram and then that endometrial sampling and make sure that that is okay and not atypical before we schedule it.
And then you schedule it. How long does the actual procedure take?
Oh, it's very quick. Anywhere from 90 seconds to 10 minutes, depending on which device.
That's pretty fast.
Yes.
I was thinking, a couple of hours.
No, it's very quick. And we do it as an outpatient, but we do use sedation.
Okay, what kind of sedation?
Conscious sedation. Some cases we'll do in the operating room, depending on the patient's medical risks, and we'll use general anesthesia for them. But it's usually very short, 10, 15 minutes.
Wow. So when you were saying that the recovery time is pretty easy, exactly how long is the downtime?
1 or 2 days.
Oh, that's really impressive.
Usually the first 24 hours you can have some intense cramping and probably need to rest, take anti-inflammatory agents, narcotic if needed. And I'd say we do the majority of them on Thursdays or Fridays, and people work by Monday.
Any other side effects that people might feel after having an ablation?
Well, initially the number one complaint is the cramps.
Cramping.
Sometimes bleeding, but not often. Rarely they can have an infection, but we give people antibiotics, so that's usually not a problem for us. And then I guess the other complaint is it just doesn't work 100% for everybody. There's probably, I mean, in my experience, failure rates can be quoted up to 30%, but in my experience, I'd say 90% are happy. Very low percentage that they have to go on and do a hysterectomy later.
Oh, that is a pretty good number.
Yes.
Will women get their periods after? Will it be just a lesser period?
Usually they have periods. Lack of periods, the medical term is amenorrhea. Of course, everybody wants that result.
Pregnancy was never so fun.
So 25% might have total amenorrhea. Most people have return to normal flow or much lighter.
So I'm curious to know, for your patients who've had this done and they return to a normal flow or a lighter flow, do they report to you an improvement in terms of their menstrual cramping? Do they have less menstrual cramping?
Usually. I mean, it's mainly for bleeding, but I always feel like if you have really heavy bleeding, you usually have cramps that are pretty bad. It will lessen both usually. But it's not 100%, if that pain is coming from something else.
Boy.
But it's mainly for the bleeding complaints.
Okay, that's really good to know. I'm just curious to know, for women, 20s to 30s, kind of one segment. When you get into your 40s, as you mentioned, then you're really, I feel like that's what's happening with me now. I'm experiencing, my body's changing. I'm done having kids. And boy, okay, things are really changing. If a woman enters into her 40s, should she automatically expect to have much heavier periods?
Not everyone, but it is a common complaint. But not everyone has problems with bleeding. It's just, I'd say in that decade, we see more complaints than we do in the decades before.
Okay. So I guess the most important thing is that you're really communicative with your doctor.
Let them know their options. Some people will use birth control pills or their IUDs that can lighten flow. So that's a better choice for them. But we do have endometrial ablation as another treatment that is quick, outpatient, quick recovery. And I think the nice thing about endometrial ablation is many women will avoid having a hysterectomy, which is more major surgery.
It is. And I think that, when you're contemplating a hysterectomy, when you think about, I think a lot of women think, ovaries are just for having children, but it's really for regulating your body and protecting you from other diseases, protecting your bones, breast cancer and all that. Can you speak to that a little bit?
Well, the endometrial ablation is only going to kind of desiccate a few millimeters on the inside. So it's not going to affect the ovaries or the tubes. And it's also not going to be birth control. I mean, we tell women it's unlikely you would get pregnant after one, but we still recommend they use birth control if they haven't had sterilization or another method. It's just much less aggressive. Even our hysterectomies, we try to do minimally invasive and preserve ovaries if, they still have a number of years for them to work. So you can do the hysterectomy and not take the ovaries out.
I think what's incredible is that women now have so many choices.
Oh, yes.
Sometimes it feels like there's too many.
Well, this is a great one. It's one of my favorite procedures because there's such a high satisfaction rate.
Well, that's wonderful. Thank you for telling us more about endometrial ablation.
Certainly.
I appreciate it. Thank you. For more information about Dr. Woodbridge, you can visit Health Central Women's Care at healthcentralobgyn.com and also on social media using the handle @HealthCentralTX.